to help prevent diabetes, one of the best ways to do it is with a good diet and exercise. We do like for people to try to maintain an ideal body weight, and they can talk with their doctor about what that weight would be. If we talk about exercise, we like for the people to exercise at least daily, and 30 minutes is the goal to exercise, and then to try to keep our weight down, especially around the middle. When we have more fat cells in our abdomen, it puts us at a higher risk of developing diabetes. So not all diabetic patients have to take insulin. However, if they are a type 1 diabetic, they do not produce the hormone insulin, so they will need insulin in order to survive. A type 2 diabetic, if their A1C level is elevated or their blood sugar is elevated and they feel like that they need insulin to lower that more quickly, then they will put them on insulin. So diabetic patients need to check their feet every day. One of the reasons why is because with diabetes you can get poor circulation, and when they have poor circulation they may experience numbness and tingling in their feet, but they also may experience some changes of color, shape. It may be cool to the touch, so they can become injured more easily and they may not be aware of it. So checking their feet daily would be something that we would want them to do. Diabetes is actually not curable, despite the fact that you will see many places that it says that it is. When we have that hormone insulin from our pancreas, it's produced from cells called beta cells, and beta cells basically deplete, and it's been proven that when a person's actually diagnosed with diabetes, they've actually lost about 50% of those beta cells and they don't regenerate. So when a person is diagnosed, they're actually dealing with about 50% of function of their pancreas, and until we can get to that point where we can regrow the beta cells, unfortunately right now the answer is not, it is not curable. The role of diet with diabetes is that the body, when you do eat, you actually process your food and turn your food to glucose. So glucose is a form of sugar. So a lot of people don't understand that everything they eat is actually going to form into a sugar called glucose, so our body can process it and use it for fuel. So when we teach about diabetes diet, we try to help them to understand about carbohydrates. Carbohydrates are the fastest foods breaking down to sugar, so it will raise their blood sugar the quickest. Alcohol is something that we do encourage patients to talk to their physicians about, because one of the things they want to make sure of is that the diabetes is in control. If the diabetes is not in control, they usually recommend that they abstain from alcohol. If they are going to drink alcohol and their diabetes is in control, they will usually give them a recommendation of how much alcohol per day would be okay. The one thing I do caution patients with when they do drink alcohol is initially it can cause your blood sugars to get low, so you can get hypoglycemia. So it is encouraged that if you're going to have alcohol, to make sure that you have alcohol with food.